Good morning, guys.
Good morning.
Good morning, sir.
How all are doing?
Good, sir.
Good.
So, how was the remaining sessions, the previous sessions? I think I was not there for 2 weeks. So, how was all the sessions?
It was
Hello.
good, sir.
Okay. Uh, so, I want to know what all were discussed during the protocol session. So, I think protocol session was already completed, right? Yes. No.
Yeah.
So, what all were discussed?
How to go through a protocol, then how to apply for ethical committee review.
Mm-hmm. Any other answers apart from Abhishek?
What are all the various things that we look for in a clinical trial protocol, like general information, trial designs, objectives, safety, and all?
Okay. And any other answers? Okay. Okay, let's go then. So I want to know, only few people have submitted the assignment, and many people haven't submitted the assignment. What is the reason? And few people only have texted in the group stating that they had some exams or something like that. What is the reason for that? Yes, it's better if you speak up, or else I have to take your names.
Sir, I had other exams which I was preparing for, so they overlapped. So I informed the Pratikya that I'll be submitting by this weekend, mostly by tomorrow.
Okay. Others? What about the other people? I'm not talking about invoice assignment. I'm talking about ICH, which I have given. Yeah, late submission it's fine. I can consider, but few people haven't submitted yet. Sri Priya, did you submit?
Hello.
Yes, Sri Priya.
Yes, sir. Good morning.
Good morning.
That certificate, right, sir?
Yes, yes.
Yes, sir, I had submitted. 19th only I had submitted.
The thing is, you have uploaded, but you haven't submitted. There is a
Oh,
submit button there. You have to click that. Then only I'll be receiving the document.
okay.
You have just uploaded.
I'll be submitting now, sir.
Yes, yes.
So sorry, I didn't
Sir,
know
No
that.
issues. No issues.
sir, ICH GCP, NIDA1, I have already completed it before. I thought of doing it again. I
Yeah,
have the
that's what
previous
I've
certificate.
told you. Yeah, that also you can upload. That is fine.
Okay, okay, sir, then I'll upload it. Okay.
Abhishek, same Abhishek. I think you have uploaded, if I'm not wrong. 1 minute. Yeah,
Sir,
yes, done.
and
Yeah, yeah. Yes, yes.
Hand in, I have to click on, right?
Yes, yes.
Okay.
Then I'll be saving the
Okay,
assignment.
sir. Actually, I uploaded on 19th only,
Now I
but I
got it.
didn't.
Now I got it.
I did it on 19th only, sir, but I
Yeah, yeah.
couldn't.
No issues. Okay. Yes. Chaitanya. Did you submit, Chaitanya?
No, sir. Like today, I will submit.
Okay.
sir,
So
I have submitted it.
yes,
You have given
Abhishek.
me marks on.
Yes, yes, you have submitted. It was by mistake. So did you inform anyone, Chaitanya, till now?
About what, sir?
What is the reason that you didn't submit?
Sir, no specific reason, sir. Just that other assignments and this college works.
Okay.
It's just 90% done, and then it's remaining. Just I'll do it today, and then I'll submit it.
So did you inform to anyone? At least did you message in the group? The reason?
No, sir.
Why?
I thought like I will say in the class.
But you don't know when is my class, right?
No, sir. I was knowing you were like said like the next classes will be taken up by you. So,
Who told?
sir, the mail which we got.
Mm-hmm. But I asked to write in the group, right? Then what is the difference between you and the people who have written in the group? At least they have apologized in the group, right? But now when I asked, you are saying that in that case also I have taken your name. You didn't even speak when I asked.
Yeah, sir. Because I was a little guilty about that, so I couldn't speak up. Today, I will make sure I will just submit it, sir. Sorry about that.
Okay. Harsha?
Yes, sir. Sir, it's not submitted, sir. Within Monday, I will submit, sir.
Why? What is the reason?
Sir, yes, I was in hospital, sir. My mother had minor surgery, so I couldn't concentrate on this. So I will make sure that I will do within Monday and I will submit, sir.
Okay, Harsha. Mm-hmm. Preeti? Is she there? Urmila? Is she there? Fatima? Fatima, you there?
Sir, good morning, sir.
Good morning.
Sir, you're talking about Malia Fatima.
Yes, yes.
Yeah, sorry, sir. I actually apologized in the group. I have my final exams from 21st of June, so I was not prepared for that. So I was preparing for my exams. So,
Which year you are studying right now?
4th year, sir.
Okay.
Yes, sir.
Thank you.
I'll be completing after 2nd of July, sir, and I'll submit in 2 days. I already took the test, but I didn't got sufficient points. So I'll retake it that after my exam, sir.
Okay.
Thank you, sir.
Yeah, no issues. Okay. Alvin, I think Mila and Preeti are absent for this class. Did they inform to you?
No, sir, not it.
So in that case, they'll be not doing any assignment. So don't assign any assignment to them, okay?
Sure, sir.
And without giving any proper reason, don't allow them to the next class.
Okay.
Yeah. So okay, guys, we'll just start with this today's topic. So, do you have any idea how to extract protocols? How to download protocols?
Yes, sir. I had downloaded.
Yes, sir.
No, the people who don't know can raise their hand. I'll show them. Why? Because the next assignment will be based on that only. The people who don't know can raise their hand. In the end, I can just show. If everyone knows, I'll be not showing. Perfect. So I assume that each and everyone knows how to download a protocol. So your next, yeah, sure. I'll show you at the end of the class. So the next assignment would be, so we'll be discussing about informed consent today as well as tomorrow. So I'll be giving you a couple of protocols, reference protocols, or else in that case, you can refer to your own protocol. So that would be, I'll be saying you by the end of the class. So what you need to do is there is this format according to City Rules 2019. So what kind of, how a protocol template looks, how a protocol looks. So according to that, you need to prepare the ICF, okay? The informed consent document. So as most of the people have done their project, so how many pages of informed consent did you use?
So mine
Yes.
was retrospective study, sir. So I did not include any consent form. I had included waiver of consent.
Okay. Others? Interns, fifth years, and other people as well. Did you use any informed consent? Just tell me that thing first. I think most of the people, they'll not use informed consent while they're doing projects.
So there was no consent for me as well as I was doing a community-based project.
Okay. 2 pages, one answer. Any other answers? Okay, we haven't used informed consent. So in that case, this would be a great exercise for you. So I'll be giving you protocols mostly. So you should use the protocol, and we'll be discussing how to what is a template basically of doing a protocol. So by using the template, you need to prepare an informed consent form, which should be more than 20 pages. Okay, which should be more than 20 pages. So that is how you have to design an informed consent. So this would be your next assignment, and the deadline will be too short. And why I have been repeatedly asking regarding the reason and why you haven't done is when you work in the real world, in a sense, when you work within the hospital or else in the industry, when you say some deadline, you have to stick to the deadline. That is the most important thing when you work for the corporates or else in the industries. So if you are not sticking to the deadline, there will be a negative mark which will affect your growth as well as your salary and increments as well. So unless you should do that, unless you don't have a major reason to say that you should not do. For example, few people have said they do have their 4th-year exams, 5th-year exams, and I don't think it hardly takes 15-20 minutes on a day basis. If you sit for 1 week at least, 15-20 minutes, your assignment will be completed. That's the thing of that part. And apart from that, fifth years, fourth years, it's fine. But fifth years, you already have the same subject in your exams as also. And if you do that assignment, it will be an add-on to you. So it's nothing. You are reading new subject and you're wasting some time. So that is one thing. And a few people, they are saying the project and all those things. So if you can't even spare 15 minutes per day or else half an hour per day to do an assignment, how can you work under high pressures? I'm not talking about normal pressures. In corporate, it's like high pressure. See, for example, I can just say you. So I think I've met Ashwita and Aishwarya at Kerala. So I went to a conference. It was on 15th, if I'm not wrong, 15th or 16th. On 14th, I off my laptop. I've logged off my laptop. So yesterday I reached again my native place. So for around 12 days I was completely off with my office work. When I just opened my laptop, there were 500 emails which I have to read. So and have to reply them back within a day or else two. And in spite of my health getting completely on a different side, I tried to reply more than 250 emails till now. And if you see my voice also, it's completely out. So unless you don't have that determination to work, nothing can be done properly. So don't try to give all these reasons like exams and all those things. I'll not even consider for next sessions. So and from the next sessions, from today's sessions, if someone is absent to my class, they'll be not allowed to the next class. And if someone is absent, they'll be not allowed for the presentations as well. They are not allowed to do their assignments as well. Okay, so this is how I'll be going from this class. So this will be my rules. So if you are absent, you have to inform at least me, or else to the respective person, or else at least in the group. That should be, or else at least to Alvin. So this is how I'll be going through all the classes. And as you have had the protocol session already, so what we'll be doing is we'll be dividing the complete complete people into 3 or else 4 groups. So at the end of the module, you will be having a presentations. Okay, you will be having presentations where you need to prepare a PPT from that protocol, and like you, in the sense, each person of that group. For example, if we have 4 groups, each group contains 4 people. 4 people has to divide the complete protocol, and they need to do a PPT, and they need to present. Okay, if at least one person is absent for that presentation, the complete group will be not allowed to present the protocol. Yes, I'm keeping it clear. I think we have it at the end of July. So mostly within this week, I'll be giving you the giving you that assignment. There'll be a deadline as well, where you can send me the draft PPTs where I can review. I can finalize the content. So after that, I'll not accept any reviewing process. So post that, you'll be having presentations where each and everyone from your group needs to prepare and needs to present the protocol. If at least one person is missing, I know most of the people will skip that. I don't want to hear any reasons. I'm saying a month ahead only. If at least one person is also missing from the group, the complete group will be not allowed to give presentations. Okay, hope you got the clarity of all the rules and all those things from the next class, right?
Yes, sir. Sir, we'll be preparing the presentation on a different protocols.
Yeah, different protocols, not on the same protocols. Each and every group will be having their own protocol.
Okay, sir. Thank you.
And what you can do is you can use the same protocol to do your ICF assignment as well.
Okay, sir. Yeah,
So for those 4 people in the group, the protocol will be same for ICF.
okay.
Yeah. So Any other doubts from the previous sessions of mine or else from Pratik? Any other doubts? Okay, so in that case, let's start this session. So can someone say if you can see my screen? So hope you got familiarized with CT rules, right? Yes, no? You got familiarized with CT rules? Am I audible?
Yes, sir.
So I'm asking a question. So did you get familiarized with CT rules 2019 document?
Not completely, sir.
Okay. So any difficulty in that?
No, sir.
Sorry? So we'll discuss. So today we'll be discussing about informed consent process and what kind of informed consent will be there, and what is the responsibility of different stakeholders involved in the informed consent, and what is the format of informed consent. So for each and every informed consent we'll be using in clinical trials, there is a specific format according to the guidelines. So what is that basic format? And according to that format only, you have to design an informed consent which should be more than 20 pages, as I have discussed. Okay. So when it comes to the informed consent, this thing. So these are the few couple of what I can say. 1 minute. So here we have few guidelines or else few important points which we can discuss. And apart from that, you have responsibility. So if it's CT rules, page number 210. So if you go to page number 210, you will find information about informed consent, and you have responsibility. So here the stakeholders are sponsors, investigators, and the ethics committee, who will be mainly involved in informed consent. And here after that, you have couple of tables. Okay. When it comes to the tables, I think if I'm not wrong, it's table number 3. Yeah. Table number 3 describes how an informed consent designing should be there. Okay. So this is the designing part. So this we'll be discussing today. The remaining portion, how an AV consent is taken and all those things, we'll be discussing on later stages. Okay.
Yes, sir.
So according to this document, what they say is, so these most of the principles what you are seeing right now, I think we have already discussed in many sessions. Like ICH also we have discussed, in the ethical principles sessions also we have discussed. So it's just a kind of revision, that's it. And we will find few new concepts here also, so that we'll be focusing on more. Okay. So when it comes to informed consent, they speaks that informed consent should be given on freely. Okay, freely given informed consent is most important. 1 minute. Yes, and it should be obtained from each trial subject. Okay, so it's not like if you have 10 subjects in the trial, so you should obtain from only subject. It's not like that. You have to obtain from each and every subject who are being enrolled into the trial, and the information of the study should be provided by investigator to the subject verbally. Okay, should be provided verbally. And here you have two documents. Okay, here you have two documents. One is patient One is patient information sheet. Okay, this is one thing, and another one is informed consent form. So, what do you think? What is the difference between patient information sheet and informed consent form?
Information sheet includes information related to drug trial, how it is conducted, what are the risk, and so all those things regarding treatment. And the other thing in that, patient has to sign that they are agreeing for the clinical trial.
Okay. So, what is the difference in that case? So, patient information sheets includes information which is given to patient. What is informed consent then?
Patient agrees for participating in clinical trials.
Yeah. So, basically, in all the present scenarios, what you see is so these two documents are merged basically. So, there will be only one single document which contains both the patient information sheet, like information which is given to the patient, and the informed consent form as well. So in the patient information sheet, you will find information which is given to subject related to trial. Trial in the sense, what are the benefit, what are the risks, what is the duration of the study, how much blood samples or else, what is the frequency of visit to the hospital, what kind of intervention, whether it is a placebo, whether it is an active R, and what kind of risk management will be taken. All these things will be present in the patient information sheet. When it comes to informed consent form, this informed consent form describes the signature part. Okay, so where this subject will be signing, that is called as informed consent form. So there is a difference between these two documents. But in the practical present scenarios, most of the sponsor companies, what they are doing is they are merging these two documents and preparing one document, that is information document as well as informed consent document. Okay, that is the difference between these two things. And when it comes to understanding, so when the investigator, it is his responsibility to provide information to the subject verbally by using a patient information sheet in language that is not technical and understandable by the study subject. So he should be aware. The subject should be aware about that subject, that language. For example, if you are in Kerala, you should either use Malayalam or else, in case you can use English, or else in case you can use Hindi as well. But you can't use Tamil. Why? Because most of the people, they might don't know Tamil, or else you can't use any Punjabi language like that. So the subject, the language known by the subject, that language needs to be used, and the verbal conversation between the investigator and the subject should not be in any technical. It should be in layman terminology. So that is the most important concept when it comes to informed consent. Okay. The subject consent must be obtained in a written used informed consent form. Both the patient information sheet as well as informed consent should have been approved by ethics committee. So this we have discussed. So when you are using any ICF or else ICD, so those two documents needs to be approved by the ethics committee as well as the central licensing authority. And when there are any changes in the sense amendments, okay, when there are any amendments, in that case also, the document, the information sheet or else the informed consent needs to be approved by both the ethics committee as well as the central licensing authority. Okay, so hope you got a clarity about these 2 points. Any confusions?
Yes, sir.
Okay. So here, have you gone through these 2 concepts? One is LAR and impartial witness. Have you gone through these 2 process, like concepts? What is an LAR?
Yes, sir. Yes, sir.
So when it comes to when it comes to CT rules, so when a subject is not able to give consent, so they have given a couple of examples here. So one is unconscious person, minor, or else others suffering from severe mental illness or else disability. So when it comes to subjects which has the above examples or else above conditions, so in that case we can use a legal acceptable representative. So that is called as LAR, and which is according to the law of India. So this is one point. So when LAR is used in only these cases according to the CT rules 2019. When it comes to impartial witness, when a subject is not able to read and understand, okay, so there is a concept of read and understand. Read in the sense he can just read, but understanding is most important. When a subject can't able to read, understand, and write, okay, read, understand, and write. So if these three is not there, or else at least any one in this case, if he can't read, if he can't write, if he can't understand, so at least one of the also is not there, then in that case we should use an impartial witness. Okay, for example, it has taken a sentence where the subject can read and write Hindi but can't understand Hindi. So what is the main reason we should use impartial witness in this case?
Patient has to be explained in his own language, right?
Okay.
He can't understand. He can't understand the meaning.
Okay. So let us take another example. So in the hospital they have only English ICF. Let us take only English ICF. But the subject knows how to read and write. Read and write English but can't understand English. So in that case, shall we use impartial witness or not?
Yes, sir.
Yes,
Yeah.
sir.
We can use.
Why?
The patient need to understand about the concept.
Yes. So let us take, he can understand English. He can't read and write English. In this case also, will you use an impartial witness?
Yes, sir.
No, sir.
No. Why? Why? So the patient, so we have English ICF, and patient can understand English but can't read and write English. So will you use an impartial witness or not?
Yeah. Yeah.
Yes, sir.
Yes, sir. We can use.
Why?
He's just reading. Impartial witness will read out whatever the content in informed consent, so the
Okay.
patient will be able to understand.
Okay. We'll read. What about writing? What about writing?
Patient can write in English, but what is your question, sir?
So here the patient can't even. Okay, one thing is reading. You are sure that this impartial witness will read out the ICF and he'll explain. But here he can't even write. So in that case, how impartial witness will be used in the context of writing?
Impartial witness can sign things.
Exactly. So there will be a signature column as well, where the instead of subject and impartial witness on behalf of subject will be signing the document. Okay. So let's take another example here. So the same English ICF, subject can understand English, read English, but writing he can't do in this case. Will you use an impartial witness or not?
Yes,
One who
sir.
can understand and write, he will be able to read also.
Sorry?
One who is able to understand English and write in English.
And he can read English, understand English, he can't write.
Yeah, we'll use impartial witness because he's not able to write.
Yeah, able to write and able to sign as well. Write in the sense, if you think in the terms of signing the ICF. Okay. So hope you got a clarity in what all conditions you will be using an impartial witness and what all conditions you will be using an LAR, right?
Yes, sir.
Okay. So now let's just discuss, like, where LAR will be there, and let's discuss about what are the responsibilities of, or else what are the tasks of LAR, or else impartial witness. Let's discuss about impartial witness. What they'll be doing.
They will read the consent form.
Okay.
Make them understand.
Yes.
They can sign.
Yes, exactly. The same thing. So the subject responsibilities are the subject when an ICF or else an ICD is being given there, they should be able to read, understand, and write. If in case at least one of the three are not met with the subject, in that case we'll be using an impartial witness. When an impartial witness is used, their responsibility is to read the ICF and make the subject understand the ICF and sign the ICF on behalf of, or else fill the ICF and sign the ICF on behalf of the subject. So these are the responsibilities of an impartial witness or else an LAR. And but the cases when an LAR is being used, when an impartial witness is being used, that those are different. So an LAR is used in these cases, and impartial witness are used in read, write, and understand cases. So hope you hope you got the concept of LAR and impartial witness, right?
Sir, can you repeat LAR will be used in which case?
Sorry.
Can you repeat about LAR?
Okay. So when it comes to LAR and for example, if a patient is there who is unconscious, who is a minor, or else which also has severe mental illness or else disability. So in this case, only LAR is used. Okay. And if in case the patient can't read, write, or else understand. So in these three cases, an impartial witness is used. And in these cases, an LR is used. But when it comes to the responsibilities of these people, those are same. They need to read and understand the subject and make sure that the signing part is done. Okay. Any doubts in LAR or else in impartial witness?
No, sir.
Yes. So when it comes to clinical trials with pediatrics, like in children, in that case, the subjects are legally unable to provide informed consent. So when it comes to legally, in a sense, they should be at least more than 18. This is the legally acceptable age when it comes to clinical trials in India. So below that, there should be an what we can say parent or else an legal guardian or else an legally acceptable representative on behalf of subjects. They will be signing the documents. When the subject turns 18, in that case, they can take the decision and they can sign the document. So this is according to Indian guidelines. Okay. So when it comes to pediatrics specifically, the subject, as they are legally not able to give informed consent, so in that case a dependent of their, in a sense, parent or else legal guardian should take responsibility to sign or else to fill the document. Okay, that is informed consent document. Okay, so there are few cases where an additional importance should needs to be also given. For example, we can take mature minors or else adolescents. So in this case, as they are near to 18, in that case, what they can what we can do is, instead of going to the parent or as legal guardian, we can directly use those subjects, and we can make sure that the ICF or else ICF is signed. Okay, so but in these all cases, as when the investigator is explaining to the subject, that language should be known to the subject, and it should be not technical. Okay, in the terms layman terminology. So these are the main important things. And apart from that, withdrawal as well. So if any of the pediatric population or else any minor or else any mature minor or else adolescents, so all these patients or else all these subjects, when they think or else when their parent or else when the guardian think that they want to withdraw from the trial, in that case that should be respected, and they are free to come out of the trial. So that is the most important thing when it comes to clinical trials. Okay, so apart from that, so you have a checklist, so what all points need to be there, so we'll be discussing in a later stage. That is table number 3. Okay, in table number 3, so you have couple of checklist. So according to that checklist, the informed consent document needs to be present. Okay, and apart from that, an audio video consent needs to be taken. So it is, this AV consent is not there in all the countries, but it's only there in India as of now. So when you do any clinical trials, it might be at any phase, it's important according to Indian guidelines that AV consent needs to be there. That is audio video, in the sense a video recorder will be placed towards the subject, and while the consent is being taken, while the explanation is being done by the investigator, when the subject is signing, so all this conversation needs to be recorded, and that recording needs to be kept with the investigator only. Okay, that is called as AV consent. So we'll discuss how the AV consent will be taken, or else how the process will be done in the next class. Okay, and when it comes to subjects with or else clinical trials with anti-HIV or else anti-leprosy drugs, so in that case only audio recording is being taken. There is no need of video recording. So this is one important point according to CD rules. When it comes to HIV patients and leprosy patients, only audio consent is being taken, and there is no requirement for the video consenting. Okay, so any doubts in this?
No, sir.
Okay, so when it comes to the responsibility, so I think we have discussed all these things in the previous sessions as well. We'll just try to summarize. Okay, so when it comes to sponsor responsibilities, so it is responsible implementing and maintaining quality assurance, ensure clinical trials are conducted and data generated, documented, reported in compliance with protocol and GCP, as well as applicable regulatory provisions. So that is one thing. SOPs should be documented to ensure compliance with GCP guidelines and applicable regulations. So, apart from that, the sponsor requires to submit a status report to the Central Licensing Authority in a periodical. So, when it comes to ethics committee, if you remember, so there are something called as periodic reportings. Did you hear about that? On yearly basis, you need to give the status, or else quarterly basis, you need to give the status to ethics committee about clinical trials.
Yes, sir.
Yes. So in the same way, when it comes to the sponsor as well, so the sponsor also, and periodically they have to give the status to the Central Licensing Authority regarding the recruitment status and the project status, like how many subjects have been enrolled, how many have been I can say how many have been screen failed, or else how many SAEs have been there, like that. So in that case, you need likewise you need to give in status to the central licensing authority, that is the sponsors. So in case of premature discontinuation of any reason, including lack of commercial interest in pursuing the new drug application, a summary report should be submitted within 3 months. Within 3 months, the summary report should provide a description of the study, number of patients exposed to the drug, dose, duration, the exposure, digital adverse drug reactions, if any, the reason of discontinuation of the study of the new drug application. So in case if the sponsor is planning for premature discontinuation, okay, so what is the meaning of premature discontinuation? What do you mean by that, premature discontinuation?
Maybe after screening.
Withdrawing clinical trials before the completion.
Yes. So if in case, let us assume the time limit of an study is for 5 years, 2000 to 2025. So if in case if this due to any reason, if the sponsor wants to prematurely discontinue in 23, that is 2023 year. So in that case, a detailed report needs to be submitted to Central Licensing Authority within 3 months, okay, and all this information needs to be described in that letter, and that needs to be submitted to Central Licensing Authority. So that is one thing. Any report of serious adverse events after due analysis should be forwarded to the sponsor to the central licensing authority, the chairman of ethics committee and head of institution where the trial has been done according to table number 5. So according to CD rules, you have a serious adverse SAE reporting and the timelines as well. So you will be discussing this SAE in the supply class. So I'll just say you. So when an SAE happens, okay, so when an SAE happens, so that information or else the details of that SAE needs to be submitted to DCGA, that is Central Licensing Authority. One is ethics committee. So ethics committee in the sense the chairman of ethics committee, and to the sponsor by the investigator. Okay, and apart from that, it is the responsibility of the sponsor to submit and document, or else after due analysis, after analyzing the information which is being given by the investigator, it is the responsibility of the sponsor to submit his independent report to Central Licensing Authority and Ethics Committee. So this is also one of the responsibility of the sponsor. Okay, so that is one thing. And you have something called as table number 5. So we'll discuss when we are discussing about SAE. Okay, in any case of injury, death occurred in clinical trial subjects. So this complete principle speaks about the medical management. When any injured or clinical trial subject are been having any SAEs or else AEs, so free medical management will be given by the sponsor. So it is a sponsor responsibility to make sure that the treatment is being provided on free of cost. So that is one thing. The sponsor as representatives who have obtained the permission of Central Licensing Authority for conducting clinical trials shall submit detailed of compensation provided or paid to the injuries. So when in any cases, when an SAE or else if any death happens, and if that death or else SAE is due to the investigational drug, or else the drug which is being given to the sponsor. So in that case, the sponsor are legally binded to pay to the subject. That is, the compensation needs to be paid to the subject. So that compensation information needs to be provided by the sponsor to the Central Licensing Authority. And you have something called as post-trial access. Do you have any information on this? Do you know what is post-trial access?
Even after the trial is completed, the subject can be provided with the drug if it is useful.
Yes. So it is a sponsor responsibility when in case the investigator feels that the subject can be treated after the trial as well. So in that case, the sponsor can provide that drug at free of cost after the Central Licensing Authority or else the Ethics Committee approves that specific process. So these are the various responsibilities when it comes to sponsor. So in the same way, you have a couple of responsibilities from the investigator as well. Okay. So when it comes to the investigator responsibility, so conduct of clinical trial is according to the protocol and the GCP. Okay, so this is one principle which we have already discussed, and in compliance per the undertaking given by in table number 4. So I think you have already prepared the IU, right? Investigator undertaking.
Yes, sir.
Yes. So according to these documents, that is protocol, another one is GCP, and other one is IU. So according to these documents, it is the responsibility of the investigator to conduct the clinical trial. Okay, during and following a subject of participant, the investigator ensure the medical management needs to be taken care for adverse events. So where any adverse events or else any kind of injury happens, it is the responsibility, is a primary responsibility of investigator to mitigate or else to minimize or else to control that adverse events or else any kind of injury. So that is one thing. And when any SAE happens, okay, so if you remember here, we have discussed SAE, right? So when any SAE happens, it is the responsibility, primary responsibility of the investigator to report to Central Licensing Authority, EC, and sponsor. So you have a timelines as well. So that is within 24 hours after the awareness of the adverse event. So serious adverse event, the investigator needs to inform to these 3 people, and after due analysis. So here in the sponsor we have discussed about due analysis. Here we are discussing about initial reporting. So this is called as initial reporting. It is done at 24 hours. And due analysis, after due analysis, it is the sponsor responsibility to submit the report to Central Licensing Authority and Ethics Committee. Hope you are not getting confused, right, about this. So we have a separate session on SAE as well. You don't need to worry. If you have any doubts, you can ask me the timelines. So any doubts in this?
No,
Yeah, thank you. So this point completely speaks about that. So when it comes to the other responsibility, when it comes to clinical trial subject, the concern needs to be taken, and all the information which is present in table number 3. So we'll discuss what is table number 3. So all the information which is present in table number 3 not needs to be explained to the subject, and they should be also given the information of the rights to claim the compensation as well. In what cases you can even claim the compensation, and they should be also having a nominee as well. So if in case the patient is dead, the only patient who is being a part of the trial is dead, in that case there should be other person who should be getting the compensation amount, right? In that case we should also take the information of the nominee as well. So if in case patient is dead, in that case the amount, the compensation amount, if the injury is due to the trial product, in that case the compensation amount will be given to the nominee, and all this information needs to be documented properly. So these are the main important responsibilities of an investigator. So it is a responsibility of investigator that he should make sure that all this information is being communicated to the subject. Okay. So any doubts in this?
yes, sir.
Okay.
No, sir.
Okay. So when it comes to ethics committee responsibility, so their responsibility is to review and give the approval for the protocol as well as the ICF. So their main responsibility is to safeguard the right, safety, well-being of the trial subjects. The ethics committee shall exercise particular care to protect the right, safety, well-being of all vulnerable subjects participating in the study. So I think we have already discussed what is the vulnerable, what do you mean by vulnerable subjects, right? So according to CT rules, these are the vulnerable subjects, that is prisoners, armed force personnel, staff and students of medical, nursing, pharmacy, academic institutions, patients with curable diseases, unemployed and impoverished persons, patients in emergency situation, ethnic minority group, homeless people, nomads, refugees, minors, and incapable of personally giving consent. So, according to CT rules, these are the vulnerable subjects. So, when it comes to vulnerable subjects, the ethics committee needs to make sure that a particular care needs to be taken when it comes to taking informed consent for these kinds of population. Okay. And they should also have a standard operating procedure, how to do all this documentation, all these things, and those needs to be documented as well. So each and everyone, whether it is a hospital who is doing the clinical trial, or else whether the ethics committee who is giving the approval, so they need to have an SOP, or else it is the sponsor. So all these three people to have a standard operating procedures. According to those documents only, we need to do the clinical trials. So any doubts in this?
No, sir.
No, sir.
No, sir.
Okay, so it is the responsibility of ethics committee to do an ongoing review. So in few intervals, so it might be according to their SOPs. So few SOPs states that we will be doing an review 2 times within a year, or else yearly one. So according to their documentation, or according to their own SOPs, the ethics committee, they have to do an ongoing review where each and every aspect of the protocol, or else the recruitment, those needs to be reviewed. So that is called a study status or the study progress reports. Okay, so where all these things will be cross-checked by the ethics committee, and they'll be giving a report as well. So that can be submitted to various people, like it can be submitted to the sponsor as well. So that is one of the responsibility for ethics committee. And ethics committee has, so this we have already discussed, ethics committee has a provision to revoke the approval of the clinical trial protocol if there any safety concern, or else in case few cases where the central licensing authority also can revoke the approval for the protocol when it comes to safety aspects. So apart from that, so this again speaks about the SAE and safety management only. So here we have already discussed about the SAE and safety management. So if you see, so these are the responsibilities of a sponsor. So sponsor, its main responsibility is when a discontinuation happen within 3 months, you need to inform. And compensation is one thing, and due analysis is one thing, and post-trial access is one other thing. When it comes to investigator, he should work. Sorry, I don't know where it is. Yes. So according to this principle, I think, yeah, according to the investigator, so according to protocol, according to GCP and according to IO, he needs to make sure that the clinical trial related activities are being done. So these are the main important documents. Okay. So apart from these things, so it is his responsibility that when an SAE and safety are being concerns to the subjects, when a safety event or else any SAE happens, so it is his responsibility to communicate to the various stakeholders within the specific timeline, and free medical management also is being provided by the sponsor. When it comes to ethics committee, so the approval revoking process, that is one thing, and protection of right, safety, well-being, and more concern, or else not more concern, so particular interest needs to be taken when subjects are being included from a vulnerable population, and on periodic basis they need to review each and every case or each and every protocol. So these are the various responsibilities of of different stakeholders which are present or else which are there in clinical trials. So any doubts in this?
No,
No,
sir.
sir.
No, sir.
So in this case, we'll just go through the content and the template of ICF. Okay. So this is how the ICF basically needs to be designed. Okay. So first section, it speaks about the essential elements. This speaks about essential elements where the statement that the study involves research and explanation of the purpose of the research. So that is the rationale and the purpose of why you are doing this clinical trial. So this is the first statement which describes about the about the ICF. Why you are using this trial, like why you are doing this trial, and what is the rationale behind doing this trial, and expected duration of the participation in the study, and description of the procedure to be followed, including all invasive procedures. Description of any reasonable or foreseeable risk or discomforts to the subject. So this is the basic essential element which needs to be there in the ICF. Apart from that, description of any benefit to the subjects or else any expected reasonable expected from the research. If no benefit is expected from the study, it should be they should be aware about this as well. And disclosure of any appropriate alternative procedures or else therapies available in the studies. For example, if it is an cancer study, so why instead of this thing do we have any other alternative treatments which is being available in the market? That information also needs to be included in this. And apart from that, statement describing the extent of which confidentiality. So how you will be make sure that confidentiality of the trial subject is being protected. That needs to be morely described. And trial treatment schedule. What is the schedule of the trial treatment? How randomization will happen? What all different visits? What all procedures will be done? So that if you see the protocol, each and every protocol describes this complete process in a tabular column, right? So have you gone through any of the protocol where all these things are described in a tabular column in a flow chart?
Yes, sir.
Yes, no, only one person. So what needs to be done at each and every visit will be described in a flowchart in the protocol. So if you have gone through the protocol, you will find all these things in the protocol. Did you go through any of the protocol? Okay. In that case, we'll just look into the protocol as well. So apart from that, yeah. So it should be also described about the financial compensation and the medical management. So when it comes to clinical injuries related to the product which is been given to by the sponsor, the financial compensation needs to be given. Apart from that, medical management as well. So when any subject is being treated for any kind of injuries or else SAE, so in that case, complete medical management is being taken care by the sponsor only. And they should also give the contact details of the study team when in case if they have any questions or else any queries, they can directly contact. So that is one thing. And any payment, if there is any payment which is related to the participation of the clinical trial subject, so that also needs to be given. And responsibility of the study subjects. Okay. And statement that participation is voluntary. The subject can withdraw from the study at any time, and that refusal to participation will not involve any penalty or loss of benefits to which the subject is otherwise entitled. So this is one of the most important which also needs to be there in the ICF. Statement that there is a possibility of failure of investigative product to provide intended therapeutic effect. So there is not mandatory that each and every product will provide its therapeutic effect. So this statement should also be present. Statement that in case of placebo-controlled trial, placebo administration of the trial subject shall not have any therapeutic effect. So this is one point. And any other information. So apart from this, there is another information which also needs to be described. Additional information which may be required. So in that case, statement of any termination of the investigative product with any other concern. So that is one point. Additional cost to the subject that may result from participation in the study. So when the subjects are participating in the study, what kind of additional cost they can get, or else what kind of reimbursement that they can get. And when it comes to the same withdrawal, so how a withdrawal can be done, what kind of term, when it comes to termination, how the termination basically should be done. And apart from that, the statement of the subject or the subject representative will be notified in timely manner if significant new finding development during the course of research which may affect the subject willingness to continue participation will be provided. So if there is any amendments to this complete sentence speaks about amendments. So if there is any change or else new information being amended in the protocol, in the ICF or else in anything, so in that information will be provided to the respective. Okay, that information will be provided to the respective participants and their representatives as well. A statement that the particular treatment or procedure may involve risk to the subject, which is currently unforeseeable.
Sir, excuse me, sir, your voice is it is people.
1 minute. Am I audible? Oh, sorry, again this one has come. Am I audible now?
Yes, sir. Yes, sir.
Okay, 1 minute. I don't know which page I'm at this. Okay. Yeah. So they also need to describe the statements and appropriate number of subjects enrolled into studies. So this is one thing. Apart from that, the format of informed consent form for subject participation in the clinical trial should contain informed consent form to participate in clinical trial. This is the complete format. So what you are seeing is complete format. Okay, this is the complete format, how an informed consent should look. And apart from that, this 5 points here, you'll have 5 points. Okay, so these are the most important. So if you see any informed consent for India, this part and this part are the most important one. So this is how an informed consent form document basically looks. So this is one. So at the end of the informed consent, so in the starting of the informed consent, you will find all this information. So this one, 1 minute. So this one you'll find, and this one you'll find. At the end of the informed consent, where the subject is signing, so all this information will be there. So if you see here, I confirm that I read and understand the information sheet dated so and so for the above study and have had the opportunity to ask questions. So here the subject will be signing. I understand that my participation in the study is voluntary and I am free to withdraw at any time without giving any reason, without any medical care or legal right being affected. Here the subject will be signing. So these are the 5 most important sentence or statements which is been given according to CT rules. So if you see any clinical trial or else any informed consent of any clinical trial right now present happening in India, so according to these statements only they will be designing the ICF. Okay. So hope you got how an ICF basically looks.
Yes, sir.
So what I'll be doing is I'll be giving you an protocol. I'll be emailing you an protocol where all the this informations, this checklist 1 and this checklist 2 information, you need to take it from the protocol. You need to read the protocol. You need to take that information to the protocol. You need to make into a layman terminology, and you need to copy in a Word document. Post which you need to completely use this format too, and you need to attach to that one. Okay, you need to just enter, or else you can do how which other way you can use, and you need to attach to that one so that you'll have an ICF with you. So in the starting of the ICF, you'll find all the information related to the study. At the end, you'll find this checklist where the subject will be signing, and this is where the subject investigator will sign. This is where the witness will be signing, and this is where the subject will be signing. Okay, so like this, you can prepare an ICF and you can submit to me. So any doubts in this? How to prepare an ICF? This all information will be there in the protocol. So purpose of the study, rationale of the study, expected duration of participants in the study, procedure, including all invasive or else any risk, benefit, financial compensation, medical management. Each and every protocol describes about this information. Okay.
Okay, sir.
So any doubts in this?
Okay, sir.
Okay, so if you don't have any doubts, I think we can conclude the class. No doubts? Okay, that's...
Sir?
Yes.
When do we have to?
Yes, Abhishek, you can go ahead.
When is the last date for submission?
Sorry?
The last date for submission.
I'll tell you. So today is 1 minute. Let me just check. So today is 26th. 3rd of July.
Okay, sir.
Yeah.
Okay, sir. Sir,
Yes.
recently I have been trying to download a protocol for dostarlimab.
Sorry, your voice is not audible properly.
Now it's audible, sir?
Yes, yes.
Yeah. So recently I was trying to download protocol. This drug dostarlimab is there, no? I was wondering if the trial is completed only, they will be giving that PDF format in the clinicaltrials.gov.
Not necessarily. Not necessarily. It's not mandatory that they'll unless see protocol describes the procedure. That's it. And there is no reason to wait until the trial is completed. Then only we can. If they are giving the statistical data and all these things, then they can wait till the end. But it's the protocol only which describes the procedure how to do clinical trials. It's their wish. It's the sponsor wish when to publish or else when to provide the protocol document. It completely depends on them.
Okay, sir. I was not able to find the PDF and download it, so I was wondering if only completed there will be.
No, it's their wish. But basically, what they do is, so there'll be a number of protocol amendments happening in the due course of the procedure of the clinical trial, basically during the duration of clinical trial. So to provide you with to provide in the open platform, so they have to submit the latest version in the sense the version which is there during the closeout, during the end of the clinical trial. So for that they have to wait till the clinical trial or is the recruitment or is the complete duration of the trial closes. So that's the reason most of the protocols you will find at the end of the clinical trial. Why? Because there will be n number of amendments in the due course. So if, for example, if it is a 5 years period, if they have 10 different amendments, they'll be uploading the last 10th amendment, not the first amendment, because that is the updated one. Okay, to upload the 10th version of document, they have to wait till the end. That indirectly means you will get the protocols at the end of the study only, mostly.
Okay. Yeah, understood.
So any doubts?
So you will mailing the protocols, right?
Yeah, I'll mail you the protocols.
So we'll be in the groups, like even this informed consent also we the same protocol we'll be doing in the groups or only the presentation?
Yes.
So informed consent also will be doing in the groups, right?
No, it is individual. Informed consent is
Individual,
individual, protocol is in groups. But for both the things, protocol will be same. For example, this 19 people are divided into 4 groups. 4 group contains 4 people. So sorry, one group contains 4 people. So those 4 people in a group needs to prepare their own informed consent and one protocol, one common protocol for presentation. Okay?
Yes, sir. Okay. Thank you.
So any other doubts? Okay, so in that case, I think we can conclude the class. Okay, guys, then have a nice weekend. Enjoy.
Thank you, sir. Happy weekend.
Thank you, sir.
Thank you, sir.
Bye.